Well, as we talk about getting back to work and perhaps a new normal at some point, will people be able to do that without fear? I am joined by Patricia Rehmer. She is the president of behavioral health at Hartford Healthcare. Thank you so much for being with us.
Sure.
So as we slowly integrate back to daily life, is PTSD something that's going to be an issue, you think, for a lot of people?
I do. I think that we're already, there's a lot of literature out about it, and I think that we will begin to see some of it. We've begun to see some of it already. The interesting thing about PTSD is that it doesn't hit everybody at the same time. So you could be involved in a situation like this and not actually experience symptoms for 6 months. But what we want to do is try and help people avoid PTSD, if at all possible, during this pandemic.
And what about the nurses? I mean, those are the people who are often helping people die alone. Are they specifically a concern for you?
Yeah, I think our healthcare workers are a concern. Hartford Healthcare has actually done a lot around this. We have a hotline for our employees, which is staffed by behavioral health experts. We have emails that people can send to, and somebody will call them back. We're really encouraging people to call this line. At the same time, we think we might need to do some more active things, get out with staff on the units, talk with them, because as you said, our nurses and our physicians and respiratory therapists, all of our health workers are really seeing things that are unprecedented.
Yeah, hearts out to them. What about for the rest of us? Do you think, is it normal to exhibit fear to be in crowds when we're allowed to be in them again, or fear of shaking hands?
It is. It really is. And I think that's one of the things that I want to say is that as part of trying to keep yourself safe from something like PTSD, you do have to understand that feeling anxious and worried right now is really a normal part of what we're all experiencing. And so certainly not to be too concerned about that. We really think staying connected is critical. One of the things that people aren't able to do right now is go to whether it's a house of worship, a church, a synagogue, they're not able to go because we're not allowing large groups of people to get together. That's very devastating for some people. So how else can you get your spiritual needs met? There are TV, there's live streaming, that sort of thing. So we do think that that's really very important. And also, I'm a little worried about individuals who have lost someone and are not able to, for example, hold some kind of service. And I think the concern with that is that we may see some disruption in people's grieving that could go on for some time because of the inability to do the usual rituals that we do under these circumstances.
Absolutely. And at what point do you think professional help is necessary so people can determine, do they need to call you for help?
Right. I think that there are certain things that you want to watch out for if you have changes in eating patterns, sleep patterns, feeling sad, crying a lot. I will say, though, as I talk to people out there now, there are people that are doing those things, right? We're all at home, we're all at the refrigerator more. So I think we have to be careful about overdiagnosing, and at the same time, we certainly want to get help to people at the right time.
Thank you for that information, and certainly want people to be aware that PTSD is something we need to look out for, so we thank you for that. On a separate note, I want to ask you, you all have moved into telehealth, and now we're hearing that there may be a problem with some insurance companies paying for that telehealth. Can you shed light on how that would affect things?
Yeah, that would be a real shame, I think, for individuals, whoever is saying they're not going to pay for it at this point. We have found it to be an incredible way to continue to treat patients. We're still doing evaluations for new patients, and probably about 80% of that is being done via telehealth. And so what we are actually seeing is that there is an increase in show rate, which means people are actually showing up for their appointments in a way that they don't always when they have to get into a site for an appointment. We are finding ways to do group therapies on a Zoom. There's many things that we are going to take out of this crisis that will potentially benefit the people that we treat.
Absolutely. Patricia Rehmer, thank you so much for your time. We appreciate it.
Thank you.